Hi, my name is Dr. Irada. I'm one of the newest pediatric dentists that's joining the Verber Dental Group. I actually didn't have a pediatric dentist when I was growing up. I think my parents didn't really, know a lot about preventative care or bringing me to the dentist, to be honest, because I feel like we had a lot of other worries in life. So the first time I went to the dentist was actually for orthodontic needs. So I had a lot of cavities as a kid. I remember being in pain a lot of times, but I really didn't think much of it. When I finally moved to the US and I had access to dental insurance, was actually the first time I had stable, continuous dental care. And I was a patient at the University of Florida Dental School. And my student dentist was the one that kind of, see me as who I was, kind of exploring career option as like a freshman in college. And she kind of talked me into, you should look into dentistry. But looking back, I think being a pediatric dentist really fulfills my dream of kind of starting early, because I had a lot of dental pain growing up, so I want the kids to be able to not have that experience, know early on how to prevent cavities and prevent pain so we don't necessarily have to get to that step. I was a pediatric dental assistant in college, just working part-time, just exploring options. And I thought that it was the craziest place on earth. There's singing going on, and there's someone's crying and someone's laughing. There's just so much going on. And at the time I thought, wow, this is such a crazy place to work. It's so overwhelming. It definitely takes a special type of person to be a pediatric dentist. And at the time I thought, I'm never gonna be that person. And then I went to dental school. I kind of explored all the specialties. I looked into general, I looked into perio, oral surgery, ortho. And honestly, eventually I just kept finding myself back in the peds clinic just because it's such a happy place to be. People are so goofy and we're always having fun. Everything is about making the experience fun for the kids and make them comfortable and making sure they're not, having a traumatic experience and they want to keep coming back. For me, really, I think it's a personal experience that I want parents to know, like, I've been through this. I have had a cavity on every single one of my teeth, and I'm not kidding, I truly do. I've been through a lot of dental work. I still cry sometimes when I get a filling done. It's an emotional experience, and I know it's not the best, the most fun place to be as a patient. So I really try my best to kind of be in the patient's shoe, and I know they're scared, I know they're nervous, and I want to overcome that fear for them. So I try to be as fun and as distracting depending on the age group, and I really do care because I've been through it, and I would rather the kids not have to go through that experience if possible. So I, want parents to know, like, I do care and I know what it's like, and I'm going to take the best care of their kids. They just have to trust me.